Good evening and hello. My name is Renee D. Waring, and I am the founder and president of Uniquely and Wonderfully Made Ministries. A special welcome to you all. Welcome to you all, and a special welcome to the new members of my community. We at Uniquely and Wonderfully Made Ministries purpose to change the hearts and minds of the public by putting forth evidence to support the assertion that people with mental illness have value. We will achieve the goal through writing and public speaking. Our mission statement: we endeavor through writing and public speaking to educate and motivate the general public to one, have an understanding and to empathize with people who have mental illness. Number 2, see people who have mental illness as equals in the brotherhood of humanity. And number 3, include people who have mental illness in the mainstream of society by making sure that they get the same opportunities that others receive. Today, my presentation is addressing the mental health crisis among nurses, article of June 27th, 2024. Professionals are not only seeing a rise in depression and anxiety among patients, but are also seeing these issues play out among their colleagues or in their own families. According to the findings from the American Nurses Foundation Mental Health and Wellness Survey, 2/3 of nurses report feeling stressed, while half feel overwhelmed and nearly half feel burned out. 1/4 of the nurses have revealed that they experience feelings of depression. The public is more aware of the willing to talk about mental health in healthcare workers. As a result, this trend, there is a rapid reductions in stigma and greater commitment to building a culture of mental health. Leaders can play a vital role in individual healthcare professionals. The unseen battle of mental health challenges in healthcare. Despite the prevalence of mental health issues among clinical professionals, these issues have until recently existed largely in the background. As a result of many struggling healthcare workers feel ashamed or lonely and sometimes less inclined to seek help. That said, things are beginning to change, and mental health awareness and acceptance now feel well within reach. Recognizing the signs of mental fatigue and burnout. Mental fatigue and burnout can manifest differently from one employee to the next. Still, Certain signs are common and may include that nurses need support, feeling cyclical about patients or about healthcare industry in general, feeling cynical about patients or about healthcare industry in general, worsening job performances, including more frequent medication errors, dreading the workday, or complaining about the task previously felt manageable or even enjoyable, changes in sleep patterns or eating behaviors. Factors affecting mental health of nurses. 1. Long working hours and high stress levels. Nurse long working hours of 12-hour shifts. This approach has its perks, but many nurses report feeling overwhelmed and fatigued following long shifts. Overtime is increasingly common, especially in response to staff shortages. Unfortunately, research suggests that nurses who involuntarily work overtime are prone to mental health issues. Working 60 hours per week can be highly damaging, not only to prompting fatigue and burnout in the short term, but also negative mental health implications far into the future. Number 2, exposure to traumatic events and emotional strain is a huge issue across the spectrum of healthcare. Nurses are exposed to emotionally wrenching situations, while many nurses take comfort in knowing that they can make a huge difference on behalf of those struggling patients. There are some issues nurses simply are not equipped to handle. When these situations arise, nurses feel powerless or guilty. Number 2, burnout and compassion fatigue. Over time, the concerns described above can lead to compassion fatigue, in which constant exposure to suffering and traumatized patients prompts a negative emotional response that makes it difficult for nurses to do their work effectively. Their feelings manifest in changes of professional attitudes and can cause nurses to withdraw from social situations of previously non-work hobbies and or activities. Number 3, lack of support and resources. Nurses are some of the most resilient professionals imaginable. They rise to the occasion when faced with crisis. Without proper support, they can be highly vulnerable to mental health issues. They feel stressed or overworked when managers ask them to work overtime or take larger workloads than they can realistically handle. Many cite struggles to find affordable childcare, while lack of decent housing or transportation may add yet another source of stress. Number 4, work-life balances, and self-care practices. Long hours and shift work makes it difficult to maintain any semblance of work-life balance. Research suggests that busy nurses may perceive greater balance if they feel engaged on the job. And number 5, impact of COVID-19 pandemic. Surges in cases prompted dramatically increased workloads, while exposure to the disease led to illness amongst nurses and ultimately staffing shortages. Protocols changed rapidly as nurses struggled to keep up. Thus ends my presentation for today. I hope that you found my talk to be both interesting and informative. My next presentation will be on the fourth Friday of next month. I will air on To God Be the Glory broadcast ministry internet station on the first Saturday of each month between 5 p.m. and 6 p.m. on TGB, tgb.org. I am seeking speaking engagements. You can contact me on M as in Mary, I as in Ice, the word recovery, RECOVERY74@gmail.com. I repeat, M as in Mary, I as in Ice, the word recovery, RECOVERY74@gmail.com. My name is Renee D. Waring, and I am the warrior warring against mental health and how it is perceived by the public. God bless you all, and thank you.